Okay, so starting off, we're going to be doing our FMX, which is a full 18 set. You have a couple of options of being able to use a holder for it, such as our snap array that looks like a little alligator's mouth. That's useful. We also have our XCP kit. I'm missing one color holder, which is the red one, just because I like using the bite tabs that we have situated on our bite wing x-rays. And I don't like using the ring or the bar because I'm more familiar with just using the basket to hold the films and just doing the positioning on my own. So we have all our 18 films here. We also have two different cups, one that's going to be labeled for dirty and one that's going to be labeled for clean. And then we also have our disinfectant wipe that's going to be helpful for cleaning our films as soon as we get them from the patient's mouth. We also have a little guide here that's useful for being able to get the correct degrees in positive or negative form that match up with certain positions of the mouth or where the teeth are. And we are going to go from there and get started. Now there is a pattern that we are using here at the moment. You may use your own pattern out there in the field, but this is the best one for our grading purposes. Right now it's just going to take all of the maxillary arch, just as we usually count our teeth from upper right to upper left, dropping down to lower left, and then we are going to continue all the way around. And after we're done with our lower left all the way to lower right, we're going to go up and hit our bite wings, which is 15, 16, 17, and 18, making our full 18 film FMX set. So we're going to get started. I already have my bite wings placed in here. A couple times I'm going to use, on one side I'll use my snap array, and another side I'm going to use my XCP holders, and just show just a mixed version of using the different holders for this procedure. I'm gonna get this. Next thing I'm going to make sure that I have is that my x-ray patient or mannequin is going to be draped with a lead apron, making sure it goes over the body. Inform your patient that you're putting this on, and you want to make sure that you situate it and put the thyroid collar together to protect our patient's thyroid and all of their organs from radiation that we do not need. Also make sure your patient's up at the correct level. Right up here to the middle of my chest is a good height for me if I'm going to be aiming for certain x-rays, and if I'm going to go towards the mandibular, I might raise them up a little bit. Move your patient around so it's easier for you to get your shot, and make it easier so we don't have to take extras. Going over to this area, make sure that your x-ray machine is actually turned on. The power button's over here at the upper right portion when you're looking straight at it. Just going to flip it on. Some blue lights are going to illuminate, and we're going to have some settings that we're going to change around. Starting with whichever tooth that you're going to be on, we need to make sure that we're set for that specific x-ray. So going over here, I'm going to be going through the whole 1 through 18 numbering system, starting with the upper right. So I'm going to start on the maxillary. I'm going to switch my button over here so it starts with maxillary teeth, which is the roots pointing up and crown pointing down. I'm going to have this over here and position it for where I'm going to use it. I'm going to go put it right over here to the patient's right. And I'm going to start my right side up with our snap array system. One main thing that I like doing, or that should be done, is when you have the snap array and you have this biting edge, which is the larger, wider part where the teeth are going to bite onto, you have your film that's going to have that pimple or the dot. And we want to put that dot in the slot, or the area where it's going to be biting down. Also, some people get confused and they say, well, it won't fit in here unless I put it up here. Well, all you have to do is just rotate it. Rotate it in a specific direction, make sure that it's biting down onto the dot. And you can also give yourself a little bit extra room on the underside of this snap array just to make sure you're not cutting off any incisal edges or crowns of the teeth. I'm going to take this patient's mouth guard out. And I'm going to situate him straight so he's horizontally just looking right here. The plane of his maxillary arch is nice and straight. I'm going to open him up really big. I'm going to put it right there for his molar teeth. I'm going to set that down. I'm going to visualize the contact and pick a specific one that I want to shoot through. Right now I'm just aiming for maxillary teeth. And I'm going to take a specific angle. I'm more comfortable with just looking at it and trying to get an angle. It's good to use the referential degrees on the paper that we've seen before. After which we are going to go out here, yell clear, make sure no one's around, and hit the button. Clear. All right. I'm going to have you open real big for me. Always talk to your patient, make sure that it's not going to be a whole silent treatment. Take your film out and we're going to go dispose of it or put it into the dirty cup. So I know that I'm done with that x-ray. I'm going to keep on going to the next one that's in line, which is film number 2. I'm going to have that, remember, dot in the slot. Make sure that that's nice in place. Sometimes it's a little bit rough on the edges, so I'm going to do a slight little bend, but I'm not going to crease my film so I don't have any errors when it goes and develops. I'm going to put it in there. I like sliding it in horizontally and just rotating it so it flips and contours to the mouth as so. I have it as far forward as I can to be possible so I can get the mesial of that bicuspid and also have a little bit of the distal of the canine. I'm going to go and aim right between the contact. I'm choosing number 4, 5 contact, and I'm going to position and take my film. Clear. All right, I'm going to have you open real big for me. Perfect. And back to the dirty cup with the one that's used. Now we're going to go and switch to an anterior. We're going to switch to an anterior shot. So now we're still going along the same arch or the same maxillary plane. I'm going to be on my cuspid now. You have 2 different things that you can use. You can either use the back side of the snap array. It's nice because it's all in one just specific instrument. Or you can use the blue XCP basket that can hold it. If you're going to be using a snap array, all you have to do is just take the dot, remember, put it into the slot where it's going to be held, and it's going to be fitted right into that fork. It's nice if you use this little fork part as the area that does not get put past the teeth. As we're looking up here as an example for this 8 and 9, if I was to put this in there, I put it in way too deep, my forks disappear. The 2 little rods are there holding the x-ray film. So I'm going to bring it down, have that fork still sticking out, and you can actually run it to the incisal edges as like a little stop. This will ensure that you don't have any crowns or incisal edges missing when you take your film. So if I was going to have a snap array being used, it's useful to have the patient come up and take a hold of this and hold it right in place. Don't move it, don't pull it in and out, because that is going to mess up the image. The other option that we're going to have is to have a blue x-ray basket from the XCP kit. When you put it in, same thing. There's a slot, there's a dot. Let's make them go together. We're going to take that. Sometimes it takes a little bit of a bend to get the film to actually go in without resistance. And once you have there, it should lock in. Make sure that the film is centered right in between the basket holder, so it's nice right between everything. And a useful thing for this is to get a cotton roll so the patient can bite down on the cotton roll here, which will do or simulate the same thing we were doing with the bite fork or with the forks on this XCP, on this snap array kit. We don't want to cut out the incisal edges, so it's nice to have something for the patient to bite down on. Let me get a cotton roll real quick. So the first thing that I want to do when I'm going to be taking this cuspid shot or the anterior centrals and lateral shot So I want to make sure that my X-ray machine is put on the correct one. Right now I'm taking a canine, so I'm going to position it for a cuspid shot. And you have a couple ways of doing this. Right now I'm going to be using a bisecting technique. So it's not a parallel representation of the tooth. It incorporates a higher degree to be made if you're going to be using it in this method. Right here, I might be able to use this with a real patient because they can hold on to it. But with this Dexter that I have, he's not going to have an extra hand to hold on to it. So my X-ray film is going to be laying more flat, like a cracker or a wafer that's in their mouth. So with that, what I'm actually going to do is leave it as it is, as it goes into the mouth. Center between the forks the tooth that you're concentrating on. So right now I'm going to be concentrating on my canine tooth. I have it nice and centered, and it's at a weird angle. It's at more of a flat type of laying down between the teeth. So I'm going to have to bisect the tooth onto the film when I take my X-ray. I'm going to visualize it, and I'm going to aim, make sure that everything's nice and lined up with my X-ray film, that I don't have any possible cone cuts. Sometimes just a minor movement can be made just to assist it, and I like tapping my X-ray tube just a little bit, and it makes the smallest amount of change. So sometimes I'll just go and just tap it a couple times, leave the room, and go take my film. So right now I'm going to work on snap array. Clear. I'm going to have you open real big for me. Perfect. Goes back into the dirty cup. We're going to go to the middle. This other way for taking a anterior X-ray with a film or with a sensor, when I don't have a snap array or a blue bite wing, a blue XCP kit, is I put it down just like a cracker or wafer, like I was saying before. Make sure some sticks outside the incisal edge. Have them bite down very lightly, especially if it's a sensor. You don't want them to bite down and try and break it if it's on its own. And I'm going to just take a high angle and bisect the tooth onto the film. And that should get me what I want. So once I get there, it's all lined up. Gonna go and take my X-ray. Make sure, since I'm doing anteriors or centrals laterals, change my sensor or my X-ray exposure time. Clear. I'm gonna have you open real big for me. Perfect. Now I'm going to be using my blue XCP basket. With the basket, I'm going to be using a cotton roll to assist me in getting this to be placed. Usually you're going to want to have the cotton roll just sitting right on top of that XCP basket's biting portion. Remember, dot in the slot. I'm going to have this over here to the side. I'm going to have the patient open real big. I'm going to have them slowly bite down onto that. And you want to make sure everything is still nice and centered for that tooth. Sometimes it takes a little playing around with how they bite, making sure they don't bite too hard so that we don't ruin the positioning of the film. I'm going to take my film, place it, I'm going to take my X-ray, change my exposure time to K9, go out here, clear. All right, and have you open big. And now we're going to cross over to our maxillary left, and I'm going to be moving on to a similar one that we were seeing before right a second ago, which is blue. Now we're going to be using a yellow basket. This is for our posterior teeth. This is the opposite version of what I was using before, which was the snap array. The same thing, has a little part that holds the basket. You can use the same trick and put a cotton roll right on the biting surface if you're worried about cutting off the crowns. I'm going to set my X-ray machine to maxillary molar, just as I'm doing. I'm going to position it in their mouth. I'm going to have you open real big. I'm going to take a premolar shot. I'm going to look for my contact. My contact I'm going to be aiming for is between 12 and 13. I'm going to take my aim and continue from there. So, X-ray or clear. All right. I'm going to have you open real big for me. Perfect. Oh, it fell in. Push that to the side a little bit. Good. Next thing I'm going to do is my molar shot. I'm going to bring it back just a slight bit more so I have all the molars in view. I'm going to check where my contact is. If you're doing a paralleling shot, you would want to make sure that the image or the film is right up against the teeth on the palate or as parallel as possible, so straight. If you cannot get it to sit in that position good enough, or when you're taking your paralleling x-rays, it's cutting off either root tips or crowns, what you can do is you can back it towards the middle of the hard palate, which will allow the x-ray to fully be able to not bend and just have it straight up and down. If I was to do a paralleling technique, I would have them bite down right there. Instead of taking really high angles, I'd want it to be the film and the cone head to be parallel to my PID. So if I was to do this paralleling shot as parallel as I possibly could, this would be what I want. And centering the film to the middle of the palate or the middle of the mouth helps with this, but sometimes it can activate someone's gag reflex. So let's take this x-ray. Clear. All right. That is our full maxillary x-ray. I'm going to have you open real big for me. Always practice talking to your patient when you are taking x-rays with them. Even if it's just a fake person, you always talk to your patient. I'm going to be going down to my mandibular arch and taking my molar shots. So with this, my patient's a little bit too low for my liking. I'm going to sit him up just a slight bit. Right about there or so. So, same thing goes in there, dot into the slot. The only thing that happens, because I'm not using the ring, if you were using the ring and the bar to help you aim for yours, you might have to switch that around so that it all equals out when you change from one arch to the other. I'm going to put my dot in the slot. I'm going to have it right between the tongue and the teeth. And have them slowly bite down. This is usually a painful shot whenever we have to deal with lower X-ray exposures. And you might want to put either a little utility wax on the corners of a film. On sensors, there's not too much you can do to soften the material, so it might just be rough and blocky. But for a film, you can do a slight little bend to the corners. Bend, not a crease. I'm going to do a slight little bend or use utility wax to soften it up. With this, I'm going to take a paralleling shot. So I'm going to have the film as it is straight, just as so. I'm going to make my PID equal to that as much as possible so that my mandibular canals or mental foramen is at a accurate spot in my x-ray as it is in the mouth. So I'm going to have this positioned and have this ready. Right now it's for a molar shot, and we're going to change our x-ray exposure time to our mandibular molars. Going to roll out here and say clear, clear. I'm going to have you open real big for me. Perfect. I'm going to go put this back in my dirty cup. Get the next one in line, which is going to be my premolar shot. Premolar shot's going to be just a little bit further than that, but the angle is going to be a little bit different. Should always be aiming between a specific contact, especially for the area that you're going to expose. Now you don't want to roll the film too far forward where it goes around the centrals and laterals of the mandibular teeth. You should be able to go and expose up to the middle of a canine, but nowhere before that. You want to go out or after or further than that. So I want to make sure I get this mesial of the mesial contact between my 22 and 21. So I'm going to pick a specific contact, which is going to be right about there or so. And I want to make sure that the film is far enough that I'm going to capture this on my x-ray. Sometimes you might not be able to get this as easy with a sensor, and what you'll have to do is you're going to have to bend or make it, instead of parallel straight, you're going to have to curve it out or make a little degree adjustment of the film or the sensor so that you can get the full amount of this tooth. Going to do this, aim it for my contacts, have it ready for my next one, and do slight adjustment. It's set for molars still at the moment, so let's go over here. Yellow clear. I'm gonna have you open real big for me. Perfect. Next we're gonna go is to our lower anteriors. We come back to our old tool, which was the blue X-ray basket for the XCP kit, and we're going to use the same method with our cotton roll. Gonna have it situated. Now it's just upside down. I just flipped the blue upside down. When you use this with the ring, you won't have to change the ring or the bar around at all. So that's a nice thing about using this system for the blue basket or the blue x-ray holder. You're going to put it right behind the tooth, so I'm going to be taking an image of my canine tooth. I'm going to have you bite down all the way as much as you can. Sometimes you have to tell them bite down till it feels like it hurts, because some people will just bite down very, very gently and it won't get all the way down to the point where you can get your full crown or your full tooth in the picture. You're going to find that. Going to, if you're using a paralleling technique, parallel it to the film. Right here, I'm going to take it just as this. I can see that my tooth is right within the film and that my PID's circular portion is aiming and getting that whole crown in the shot. We're going to change our setting. We're going to go over to our canine tooth. Yell clear. And we're going to move over to the middle. I'm going to have you open real big. You drop the cotton roll. It's all right. I'm not going to need it from this point on anyways. The next one, that, as I said before, where we had the example of biting down like a wafer, we're going to use the same thing, but we're going to be on the mandibular instead. You're going to have your wafer, you're going to have them bite down slightly, except this one's a little bit harder to be able to get because you might have way too much foreshortening to bisect, or foreshortening degrees to bisect that angle. So sometimes when it comes to this, it's not having them bite down fully, it's just having them bite down a little bit so that the x-ray actually bends down. It's not flat as we were having before. You may have them either use such a device to help make it bend on its own, or you might have them just hold it with their finger, which is not advisable. We want to make sure that nothing is as least radiation is exposing their body as possible. I'm going to slide it down a little bit and have them stay open just like that. Bite down just a slight bit to push the x-ray down a little bit. All right, I'm going to set it to my centrals. Clear. Open. And we're going to come back right over here to our snap array, kind of making my right side my snap array side and my left side my XCP kit side. So with this one, you're definitely going to need the assistance of a patient's arm to be able to hold this, because it's a little bit more weightful with how much extra piece it is, so it wants to fall down. Another thing that you could always do is, instead of using the fork method, and remember, if we are going to be using the fork end of it, we want to not cover these two prongs that are there. Another way of doing it is taking the little alligator teeth side and giving that a little snap so that they're not trying to do this like chicken wing motion of holding it or holding it off and it blocks our x-ray. You can have it just like this, put it into their mouth in whichever direction is the opposite one. So if I'm taking this side, it's going out here. If I'm taking this side, which is my mandibular canine right, you can have it over here off to this side. Leave a little bit extra over on the top so that we can have that crown be able to be captured in this film. So I have it right there. Usually this is going to be a really sensitive x-ray. It's not going to be that nice when a patient has to bite down to get this film, because all of the frenum of the tongue and all the sensitive soft portions of that's right behind the tongue is going to be being pushed around or pierced. So try and make sure to make it as comfortable as you can for your patient. I'm going to come right under. I'm going to take a high degree or a really high angle so I can get all of that canine on there. And we're going to change our setting. Right now this film is a little bit off center. It's not fully up and down. It's got a little bit of a canting going to it. Clear. So when we develop this x-ray, we'll see what's going wrong with this specific lower right canine. We're going to move over back to our mandibular bicuspid shot. Now this is what I was talking about with the snap arrays, is that if I was to try and put this and do our dot in the slot situation, some people might complain and say, well, the dot's not in the slot. Well, it's in the slotted area, so just consider it as if the slot or the biting force is on the same side as the dot. That is a correct way. The reason is because the dot, we do not want it to be over any diagnosable area. So for PAs or periapicals, we don't want the dot to show up on the root tips or the apices of the teeth, because we want to see if there's any issues there, such as cysts, or if there's anything wrong with that root canal. If we're trying to verify root canal's length, we don't want the dot obscuring any of that. Well, they might say, well, what about the dot? The dot is ruining the coronal portion of it. Well, that's not too much of an issue, because our bite wings that we are taking should give us a nice representation of those x-rays. So going over here, I'm going to push it as far forward as possible. You're going to have them bite down. You're going to aim. You don't need too much of a degree change for this, but you want to make sure you're slicing right through that contact area, making sure that everything gets captured. We're going to change our settings over here, and we are going to take the shot. X-ray. Going back in there. If we were doing a sensor shot, all we'd have to do, because we don't have films to change out, is we would just open, move it back just a little bit, have them close, and then just move it back, go take the other shot. Makes it really quick when we're doing digital. But with film, we got to change it out every single time. And you might have an office that uses phosphor plates, so a way where we can reuse the films and they just get irradiated, an image is captured on them, and they're made into digital, but they're really films, and then they can be reused. They're nicer because they can still get this bend, a little bit of a comfort to the patients than a digital full sensor would be able to do. Dot in the slot, look at my molars. Now this one has a really crazy angle for my tooth number 31 and 30. It's got a super mesial angle for this between those two molars. And over here we have a little bit less of that mesial angle when it comes to our bicuspid shot. So I want to make sure I'm trying to focus on whichever I'm trying to get for the x-ray type. So over here, I'm going to aim through that molars so I can make sure to open that shot, get that shot open, no overlapping, and we're going to take our film out. X-ray or clear. Open big. All right. Last part is going to be our bite wings. So our bite wings are going to start over here on patient right. Our patient's right is going to be right in the back or in the posterior for our molar shot. Sometimes in the real world, it's nice to start off more in the front so that they get used to something being in their mouth before you go all the way back and activate anything with their gag reflex. So out there, I like to take it easy, take my premolars, then my molars, instead of going all the way back and getting my molars and having an issue right off of the bat. Because once they start gagging, anything else after that is going to be too close for comfort. So I'm going to stay at more of a comfortable distance and then go to the danger zone when I need it. So going right here, I'm going to go and start on my molars. I'm going to have my bite wing tab sitting on my molar teeth only, on the full molar for my first and second. Going to pick my contact. So my crazy contact here is going to be between number 30 and 31. I'm going to find that, aim, take my film. Now we need to change this once more for the last set of 4 films to our bite wings, which is going to be the 2 teeth that are coming together and there's a little black line in the middle. That's our bite wing setting. Clear. Open. We're going to put this back away. So do a little bit of a bend here. And then come up forward. We're going to be working on our, reposition that. We're going to be working on our premolar shot. Going to get it in there. I'm going to choose a contact after they go in. For this one, the bite wing tab should be at least on the full coverage of the second premolar. So I'm going to cover that to full. But I'm going to also take a look before they're fully biting down to make sure that that everything's covered that I want. So with this, I want to make sure that the mesial of my first premolar is in the shot. So it should go past at least halfway, or the film should go at least halfway into or behind the canine. I'm going to choose my angle. So right here, I'm going to be aiming for this 4 and 5 contact. So I'm just going to aim right there between 4 and 5, making sure that my line goes and bisects it. Clear. Open big. All right. Go put this back. Over to this side. You notice I'm rotating this to a specific side. I don't know why I do it or what position I like it. If I like having this little area on the left or the right, for some reason I just feel like there's a preferred way with me. And I have my patient open real big. I like going to the right side and starting at the same area that I did before. So I'm going to be covering both of those molars with my bite wing tab. Choose a contact. I'm going to be choosing to go through number 18, 19. So I'm going to go right in there, take that angle, take the shot, X-ray or clear. I'm going to be open real big. And the last X-ray of our full 18 set. This should go fairly quickly. Of course, with films, you can go quick on the film part, and then it'll still take 7 minutes or something to get all of your films out of the developer, 7 to 10 minutes or so. So there's always going to be a little time that you're going to be anticipating and waiting. I'm taking my premolar shot. Have your bite wing tab at least fully covering the second premolar. You're going to choose a contact. So this one's got a little bit more of a mesial angled contact, especially if I want the mesial of this number 21 or the first premolar. So I'm going to try and aim and open that so I make sure I get that 21 mesial cleared so the doctor can have a clear vision of it. You ready? X-ray, clear. All right. I'll have you open real big. And that should be the last one. They all should be in the dirty cup at this point, and everything else can be moved on to the next portion, which is going to be our developing cycle. So going back over here to our set, now that I've taken all of my x-rays, I have nothing left except the remnants of the holders that I've been using. So my snap array, my XCP, anteriors, posteriors, and the assistance of a cotton roll for some of the x-rays that I'm using. I have one of my cups filled up with all my 18 films. I have one cup that's empty because that is my clean cup. It hasn't been touched by or used used and transferred to there just yet. So once I have all of these are going to potentially be going over to our developers. Our developer needs to stay clean because it is a moist, dark, and heated environment. So we want to make sure that nothing gets contaminated over there. So we're going to use our disinfectant wipes to wipe each one of these individual x-rays, wipe them off, and the last thing that it should be touching is the wipe and drop it into our clean cup. Of course, it's not 100% clean, but it is clean enough on the outside that's been touched by saliva, blood, drool, any type of bacteria or food. So we at least cleaned a good majority of it off before we take it over to our developer.